So just take a look at this poor guy, the guy that I diagnosed with trigeminal neuralgia. First, he came to see me for this tooth in 2019. See, he still had tooth number 18. All right, so I diagnosed him in 2019 as having trigeminal neuralgia. I sent him to a neurologist, and he was fine. He with medication, he was fine. All right, so now look what happened. You know, I saw him for tooth number 15. Someone else had already done the root canal on him, and he was complaining about that. Remember, look, he still had tooth number 16. All right, and again, this is 2019. All right, so upper anterior, and this is his upper anterior in 2019. So let me. Then he had a problem with his canine here, tooth number 11, and it was legit. I tested it; it was legit. He got a temporary crown, and after the crown prep, he had a toothache, and that was legit. I diagnosed that as irreversible pulpitis, and I treated tooth number 11. All right, and again, that's X-rays from before I did the root canal in 2019. So that's my root canal from 2019. You can see the temporary crown on his tooth. And I did the root canal again. You can see 2019. Okay. But he keeps coming back, and he keeps complaining of pain and issues with his teeth. After I diagnosed him with trigeminal neuralgia, legitimately he needed a root canal, tooth number 11 again, because his dentist did prep the tooth for a crown, put a temporary crown, and after that he was in a lot of pain, and that was irreversible pulpitis. So again, I see him a month later and he's complaining of pain. So we keep taking x-rays, making sure he's doing okay. And I keep telling him, you need to give the medication that the neurologists give you a chance. All right, so now he comes back to see me a month later after that. Now we're in 2020. He had his tooth number 16 pulled. Tooth number 16 was fine. There was no reason for him to pull it. But he had tooth number 16 pulled. Again, because he goes to the dentist, see, 2020. He goes to the dentist and he complains of pain. And dentists, oral surgeons, they misdiagnose him. And they pulled his tooth number 16. Again, it's a wisdom tooth. Probably no reason to pull it, but they misdiagnosed him, and the patient didn't tell him that, hey, this endodontist has diagnosed me with trigeminal neuralgia and I'm on medication. He probably didn't tell him. So they went ahead and pulled his tooth because he probably was complaining of pain, or he was complaining of pain on the left side, and the dentist or the oral surgeon didn't know what to do. So they said, all right, fine. We're just going to pull your wisdom tooth and see what happens. See, so they went ahead and pulled his wisdom tooth. And again, when I see him in 2020, now tooth number 18 is gone. So they went ahead and pulled tooth number 18. So they pulled the wisdom tooth, number 16. They went ahead and pulled tooth number 18. And that's the root canal that was done in 2018. And you can see the tooth was fine now, even in 2020 was fine. So they went ahead and pulled tooth number 18. Tooth number 18 was completely fine. Again, they're misdiagnosing him. They're not realizing what his problem is, trigeminal neuralgia. So they're just doing root canals on him. They're pulling his teeth. They're putting crowns on his teeth. They're filling his teeth. They're just completely misdiagnosing him. I diagnosed this guy in 2019 as having trigeminal neuralgia. I sent them to the neurologist. The neurologist confirmed my diagnosis. The neurologist confirmed that he had trigeminal neuralgia. The neurologist put him on medication. Yet he still goes to the dentist, goes to different dentists and complains of this and that, and doesn't disclose the fact that he has trigeminal neuralgia, or maybe tells him, and they don't understand what it is. So they do root canals on him. They extract his teeth unnecessarily. They do root canals on him unnecessarily. They put crowns on his teeth. They replace his fillings, all that stuff, because they don't realize that he has trigeminal neuralgia. Look, see, they pulled it tooth number 18. That was a healthy, good tooth. They pulled tooth number 16. It was a wisdom tooth. They pulled it for no reason. They probably did this root canal for him for no reason, for all I know. Then he comes back to me again last year in 2022. Now tooth number 10 is missing. They pulled tooth number 10. I did a root canal on tooth number 11. Again, this was a legitimate root canal. He really needed it because his dentist prepped the tooth for a crown. Put a temporary crown on it, and afterwards he was in a lot of pain. He had temperature sensitivity and what have you, and I confirmed it, and I did the root canal in 11. But tooth number 10 was fine, but they went ahead and pulled tooth number 10. Again, they're misdiagnosing him. This guy has trigeminal neuralgia. So they're just doing root canals on him, pulling his teeth left and right. He comes back to me for me to do root canals on him. And every time he comes back, I refuse. I say, you have trigeminal neuralgia. This is your trigeminal neuralgia acting up. You need to go back to your neurologist. Your neurologist needs to address that, needs to adjust your dosage. So I refuse to do root canals on him. All right. So he comes, look how many times he's come to me and how many x-rays of it. Every time I refuse. I say, I'm not going to do a single root canal on you. He comes back to me for root canal of anterior teeth, on lower anterior teeth. He comes back to me again for root canal on upper left side teeth. He comes back to me for root canals on the lower left side teeth. Every time. So today he was back. He wanted me to do a root canal on let's see. He wanted me, look how many x-rays I have on him. I mean, look at that. Every time he comes back, I say no. So again, today he was back and he was complaining of pain all over. And he wanted me to do a root canal on tooth number 29 here. Or 28. I look at the tooth, I'm like, the tooth is fine. Doesn't have a cavity. There's no pericordial lucency, percussion within a palpation. You don't need a root canal. He says, what if I pull it? Look how many teeth he's lost here. They dentists and oral surgeons, they misdiagnose him and keep pulling his teeth, keep doing root canals on him, keep crowning his teeth, keep doing fillings on him. So he's like, what if I just go ahead and pull this tooth? The patient asked me today, he says, if you're not going to do a root canal, I'm just going to pull it. I said, listen, you have trigeminal neuralgia. This tooth doesn't need a root canal. You need to go back to your neurologist. The neurologist needs to adjust your dosage. I said, if you pull this tooth now, okay, next month it'll be this tooth. Will you pull this tooth too? Just look at this. Look at this. All of these times that he's come to see me, and every single time I say no, I refuse. I say, I'm not going to do a single root canal on you. He goes somewhere else, either gets a root canal done because they misdiagnose him, or he goes somewhere else and has his teeth extracted. Look how many teeth he's lost. Look how many uneducated endodontists, dentists, and oral surgeons are out there. That they don't see the pattern. They can't diagnose this guy. I diagnosed him in 2019. The first time I saw him, look, I can go back to 2019. The first time I saw him, I diagnosed him and I refused to do treatment on him. And he keeps coming back here to me for treatment. And I keep telling him, you don't need root canals. You don't need root canals. You have trigeminal neuralgia. You need to go back to your neurologist. Your neurologist needs to adjust your